Okay, my name is Greg Owen. I am Activism Coordinator for Terrence Higgins Trust in the UK. We are the UK's largest HIV and sexual health charity, and I'm co-founder of iwantPrEPnow. There we go. iwantPrEPnow is a website which gives you all of the information that you need about PrEP, what to do before starting PrEP, what to do while taking PrEP, and if you're thinking about stopping PrEP. But crucially, what we do is, okay, it's a little bit dated now, we still do it, but in the absence of a provision from any of our health systems in the UK, we signposted where to buy genuine generic PrEP at a fraction of the cost of listed drugs. So when we launched, 1 month of Truvada, so one pot, would have cost £400. When we launched, we were able to signpost 3 months for £150, and now it's as cheap as £60 for 3 months. Thank you. So, I'm not going to tax you too much on details in this presentation because some of the people that I reference are here over the course of the conference, so I'm going to signpost you to them. But is online generic PrEP the real deal? Is it genuine? So we had a paper published in the summer which was completely independently done from me and anonymous. So Dr. Will Nutland of Team Prepster, prepster.info, they did trial purchases from 6 of the major community/online generic suppliers, and they tested a total of 14 drug samples in lab. There were no fake preparations discovered, and these sellers were unaware that this mystery shop was taking place, so the buyers were anonymous to the sellers. So that published paper is on Prepster's website. But if we rewind a little bit further to February of 2016, so between February 2016 and September 2016, Dr. Neka from 50 16th Street, put your hand up, Neka. There we go. So oh, you got I didn't even get an applause, but so Dr. Neka, when she was based at 50 16th Street, which is Europe's busiest sexual health clinic, they have the largest cohort of self-sourcing PrEP users, the largest cohort of PrEP impact trial NHS PrEP, and probably the largest cohort of MSM on immediate start treatment. So they're really battling out there with combination prevention. They did some tests on PrEP users' blood, a blood test known as a therapeutic drug monitoring test, which measures the level of drug in a user's body. So they tested 234 people. And of those 234, 191 were referenced through from iwantPrEPnow, one of our lead sellers. Again, no fake preparations found, and no HIV transmissions within that cohort. So I've just pulled this page up from Green Cross Pharmacy, which are one of the pharmacies listed on iwantPrEPnow. So it really depends on where you are as to whether you can advocate for and encourage people to self-source generic PrEP online. So if you go to Green Cross Pharmacy's delivery tab up there in the middle, they have 52 countries listed where they can deliver to, and they also have a description of the specifications of each region. I think probably best, because we are a diverse group from across Europe and Eastern Europe and further, is that if you are interested in exploring this further and liaising with some of the sellers we have on iwantPrEPnow, is I can facilitate those introductions. But a few quick learnings. I'm up to 4 minutes. So just some regions, some region-specific learnings over the past 4 years. So Ireland had piggybacked on the iwantPrEPnow model and created a gorgeous, beautiful region-specific website. Some of those self-sourcing PrEP imports were stopped by border control, and it got a little bit dicey at one point. So Ireland now, you can order online as long as it's accompanied with a prescription. So it's good to buddy up with your clinicians. I think just yesterday Ireland announced €3.5 million for a PrEP provision, which will start providing free PrEP to people who could benefit from it in the next couple of weeks. So great news there. Canada also piggybacked on the iwantPrEPnow model and discovered that you could actually order 3 months generic PrEP to the US and go across the border and pick it up I'm still baffled as to why we would have to do something like that. Spain, again, it's illegal to import pharmaceutical drugs, and they have had to list that on their website that it's illegal to do that, but they put a cheeky signpost to iwantPrEPnow, and we managed to get around it. And Germany, again, Nick is at the back, and Nick does a lot of advocacy and campaigning work in Germany. I think their PrEP website encountered some potential legal challenges with a hefty fine. So it's always worth checking the import regulations of the country that you're delivering to, the legality of signposting, and sometimes what's perceived as promoting prescription-only drug, and explore parcel forwarding services. So we know, I don't know what Brexit is going to do to it, but we know that a lot, I know I said the B word, a lot of people were importing their 3 months generic PrEP to the UK because it was perfectly legal, and then using a third-party parceling service to get it out into mainland Europe. So another reason to fuck Brexit. Okay, I would say involve your clinicians. So what we know, if you strip it right back, is the only thing you really need before you start PrEP is that 4th generation HIV antibody antigen test. That's all you really need. Obviously, we would like you to check your renal function, and we would like you to have it monitored regularly, but when we were doing PrEP in the wild in the UK, you couldn't get PrEP support. You couldn't get that 2p urinalysis dipstick. So involve your clinicians, because they're the people who are going to be seeing the people that you're advocating to and signposting for. And I'd have to say, actually, when things really started to move in the UK is when clinician activists buddied up with community activists, and predominantly gay and bisexual men showed up at clinic demanding support. Okay, so I've highlighted that. I'm going to be here all weekend, so you can speak to me about any of the specifics. But I just want to, I've touched on these things a few times when I've presented, but I just want to present a little bit on pushing harder, evolving the model, demanding leadership and assistance schemes to make sure that we're not leaving anyone behind, or that in our limited capacity as community advocates that we're doing our best to make sure that there's equity there. So the Mike's Portman PrEP Access Fund I will talk about, that's a THT initiative, the PrEP Shop at 56 Dean Street, and I'll also talk about community assistance programs, which are predominantly being led and driven by the guys in Australia. So our Mike's Portman PrEP Access Fund is a THT initiative which provides free PrEP for up to 1,000 people over 2 years. There are 3 sets of criteria. Cannot access health system trials. So in the UK, we have 4 devolved governments, each have some sort of PrEP offering. Scotland is the only place that has commissioned PrEP as part of specialist services. They also need to meet clinical eligibility criteria as outlined by the BASH-BIVA guidelines. And they need to meet the financial eligibility, which is no income apart from benefits. And we have kind of opened that up a little bit. We wanted to remove as many barriers as possible, so we opened that up to low income and students. So essentially what this Access Fund does, so we're the UK's leading sexual health and HIV charity, and it's a £13 million NGO, and I don't mind saying they had some dire, terrible, abysmal, awful leadership before I joined. But no, I will call that out. They really sat on their hands with PrEP through into the mid-noughties, early 2000s into the mid-noughties. They really sat on their hands. So what THT did, there's some really, really proactive leadership there that decided what they would do is make free PrEP available to those who can't afford to buy it themselves. So we pre-purchase a block of codes from one of our suppliers, one of the sellers, and they issue us with codes. We have to do that for the legality of the situation in the UK. We can't give you free PrEP, and we can't buy it for you, but we can give you a code worth the value to use at point of payment. So they adapted the model a little bit, but I really think this is key, and I'm really proud to work for this organization showing this amount of leadership. Also, 56 Dean Street, now I don't know what it's like regionally for everyone in the room, but they were able to make PrEP available to their patients by using additional private care. So it was initially a model that was in place for cancer patients who wanted to try new and uncommissioned chemotherapies. So it's the same model, the same dynamic, and they've made PrEP available I think currently it's almost 2,000 people have accessed that since it launched in February 2018. So they've actually managed to drive the price right down to £17.50 per pot if you buy 6 months at a time. And I touched on it just briefly at the start of this, the Community Assistance Programme. So I have to acknowledge here and pay deference where it's due. The Community Assistance Programme is what inspired the Mag Sportman PrEP Access Fund. So the guys in Australia, the PrEP advocates out there, were adding a certain percentage to the cost price to customers, and they were accruing a kitty, if you like a surplus of PrEP that they could allocate to people who couldn't afford to buy it for themselves. They've also looked at some incentivized referrals like Uber, where you get a code and you pass it on, and both parties benefit, and pay it forward like Starbucks. But let's not talk about their tax returns. Okay, and finally, I think what's really, really important when we talk about self-sourcing PrEP is, first of all, that no one gets left behind, and I'd be the first to acknowledge, as the person who's been on the forefront and kind of championed self-sourcing in the absence of a viable alternative. If you're encouraging people to do this, it's inequitable from the offset. So it very much depends on your social mobility, your social economic status, how keyed in and linked in you already are to services and HIV awareness. So it's inequitable from the start. But what you really need to be championing with is what I think we all in the room should be championing and campaigning for, which is free in the regions where it can be free, or very, very, very affordable and accessible PrEP for all who need it. In the UK, it's free because we have a free healthcare at point of entry. So your policy needs to work hand in hand with your strategy. And the final thing I will say as a person living with HIV is that the U equals U message always goes hand in hand with your PrEP message. Thank you.